There's nothing better than when we get to see children that have been coming to our office from when they were in preschool and now they're graduating high school or on to college, and even coming back at times to show us what they're doing, telling us about their families as they start to have children themselves.
What's fun is we know that we're making an impact on the kids when we see them in town, where they'll call us and they're surprised to see us around, but they want to run over and give us a hug or a high five. And that's when we know we've really got through to the kids.
Our philosophy with Kids Teeth has always been to have a family-friendly environment, not only for the child, but for the parents. Our favorite time to see a child is when they're first starting to get their teeth, and that's often between 12 and 18 months. If we can see them at a young age, we're able to prevent problems so that their initial visits are fun visits.
There's several things that help us make the experience comfortable for the kids, not only from the staff and only having caring, engaged, or excited staff to work with the kids, but also it's the environment. I mean, we spent lots of time and research into what can make the experience more comfortable. It's the colorful office, it's the fun murals on the wall, it's the huge playroom with built-in slides where the kids can relax in both before and after the appointment. So it helps cut the anxiety down and puts them at ease.
Our environment at Kids Teeth is one where we like to have a lot of fun, where we like to have it laid out so that kids are really comfortable. With our team of experts in child behavior, we're able to get those children in a comfortable place without having to always use sedatives and other medications.
And the TVs on the ceiling make a huge difference just to help the kids relax. And that alone has been able to allow us to drop back on the amount of sedative medication we have to use to relax the children. When we're done with treatment, the biggest issue that the kids have is they didn't finish the movie. So if their biggest frustration is that they didn't get to finish the movie, but they didn't even notice anything happened to their tooth, I'd call that a successful visit.
One of the passions of our practice is to be able to spend individual time with not only the patient, but with the parent. There's nothing better than when you can look into the child's eyes and they're focused on you and listening to everything you're saying and taking it in and wanting to learn more about how to keep themselves healthy from a dental standpoint. We just have a passion for children and want to see them grow up and have healthy, not only healthy mouths, but healthy bodies, and we want them to enjoy coming to the dentist.
It means that we can specialize treatment to that family and maintain that relationship that we're building. There are other offices that will just crank patients and families through where the doctor never gets to speak to the parent. The children only come back, get an exam, and rarely see the doctor longer than a minute or two.
We understand the great responsibility of taking care of children, and we understand parents are trusting us with their kids, and we take that very seriously, but are also excited about opportunities to help these children be comfortable and grow and trust us as their dentists and become part of our family, and we hope to become part of their family also.